Hello, everyone. Our presentation focuses on nurse distress during and after the COVID-19 pandemic. We are focusing on a 2025 CBC first-person article titled, "It's My Dream to Become a Nurse, but the Unpaid Work Nearly Broke Me." The author, nursing student SU Jakob, describes being praised as a hero while carrying an extreme financial strain for unpaid clinical placements, long commutes, and high living costs. His experience reflects a wider crisis where nurses are relied on heavily, yet many feel unsupported, undervalued, and pushed to the breaking point. This is a major concern for health professionals because nurse well-being directly affects patient safety and strength of the entire healthcare system. Jakob's experience aligns with research demonstrating increased burnout, workload strain, and moral distress among nurses during and after the pandemic, reinforcing that this is not an individual problem, but a widespread workforce issue. A phenomenological approach guides our discussion by focusing on the lived experience of nurses like Jakob so we can understand how distress affects identity, motivation, and ethical care. This aligns with our program's commitment to dignity, compassion, and advocacy in nursing. His story shows that need for system changes. Nurses must advocate for improved mental health supports, fair workloads, safe learning environments, and financial compensation for required training hours to protect the well-being of both nurses and patients. These implications connects directly to the four contributors of nurse distress during COVID-19 that our team will expand on today. Hazal will examine the financial impacts of low wages and unpaid placements. Wadad will explore ethical tensions surrounding vaccination enforcement. Sydney will discuss the rise in mental health challenges and burnout, and Chloe will address nursing shortages and unsafe staffing. Together, these issues show why we must protect every nurse's well-being to ensure safe and sustainable care.
The COVID-19 pandemic placed enormous pressure on Canada's healthcare system, exposing major issues among frontline nurses. Many were forced to work long, unpaid hours to meet patient needs, raising concerns about fairness, well-being, and sustainability of the nursing profession.
What does the COVID-19 pandemic mean to the working conditions of nurses in Canadian hospitals?
During and after COVID-19, hospitals faced severe staffing shortages, forcing nurses to work extra unpaid hours. This led to burnout, stress, and lower job satisfactions due to heavy workload and limited time.
What is significant about unpaid overtime to nurses, and what solutions does the article propose?
Unpaid overtime shows a lack of respect for nurses, time, and effort. Many stayed late to finish tasks without pay, leading to frustration and burnout. The article suggests fair pay, safe staffing ratio, and better support to protect nurses' well-being.
What are the long-term consequences of unpaid overtime and poor working conditions for the Canadian healthcare system?
If not addressed, more nurses may leave the profession, worsening staff shortages and lower care quality. The article calls for better working conditions, fair wage, and stronger support system to prevent future crises.
Since the COVID-19 pandemic, the nursing profession has received greater public attention than ever, influencing how nurses are viewed, elevating them to hero status while frequently simplifying the complexities and professionalism of the nurse's role. Although perceptions of nurses during COVID increased public recognition, it also increased the enablement of familiar narratives, often overlooking the emotional and ethical challenges nurses face in their daily practice. This issue remains current as enhanced public perception of COVID continue to shape how nurses are valued, supported, and represented today.
How was the subject presented? What is the philosophical approach used, and how does this framework enhance the discussion?
Within the CBC News article are nursing issues expressed with a critical social theory approach from a first-person narrative presenting challenges faced during and post-COVID-19, where the hero image contrasts with the challenges and lack of institutional support in the profession, revealing a gap between public perception and lived experiences. This enhances the topic by drawing attention to institutional shortcomings and encourages reform, while within the discussion paper of Vandersingel and Brouwer is the use of the phenomenological approach critiquing perceptions of nursing to critically reflect on how these views influence the nursing identity, experiences, and social influences that contribute to the nursing image. This enhances the topic by addressing limiting narratives and stereotypes, providing insight into personal experiences and challenges faced by nurses.
Are there any related cultural considerations?
There is an absence in perspectives from Indigenous and internationally educated nurses, limiting the topic as these voices would provide a more inclusive and comprehensive understanding regarding how the pandemic has shaped the nursing image.
What are the potential nursing implications?
The spotlight on nurses since the pandemic has provided an opportunity to reframe perceptions. While the public attention and appreciation has increased, a genuine transition will require efforts towards structural change and personal support. From a phenomenological perspective, nurses' lived experiences during the pandemic emphasizes the importance for adequate reflections and support systems which reinforce a sustainable and accurate professional identity. Through the lens of critical social theory, the enhanced public image needs to translate into tangible professional empowerment as nurses have little influence on healthcare policy changes addressing remuneration, and to ensure collaboration with nurses in decision-making processes.
During the COVID-19 pandemic, nurses faced overwhelming workload, staff shortage, and constant changes in safety protocols. Many felt unprepared and fear of infecting themselves and their family. Globally, nurse burnout rose significantly, with studies linking poor sleep quality and psychological distress to higher burnout levels and reduced job performance.
What was it like working as a nurse during the COVID-19 pandemic? And did you feel prepared?
It was one of the hardest times of my career. Every shift felt chaotic. There were too many patients and not enough staff, and safety protocols changed daily. I was exhausted before the day even began. I was scared of bringing home the virus to my family, especially in the early months of training. It was inconsistent. I found myself constantly figuring things out on the spot. What made it worse was seeing coworkers get sick and hearing about over 1,500 nurses in 44 countries who have died, and about a quarter of healthcare workers' deaths were nurses. It was terrifying and overwhelming.
How did all of that affect your mental health?
It took a huge toll. I wasn't sleeping well, and even when I did, I would wake up in the middle of the night thinking about my patient. A lot of us felt anxious and depressed, and some of us even developed PTSD from everything we saw. The emotional weight was constantly there and never felt at ease. I felt like I could never leave work behind even when I'm at home.
Did burnout affect how you worked or cared for patients?
Absolutely. When you're tired and stressed, it's hard to focus. A simple task starts to feel overwhelming. I noticed myself becoming more forgetful and less patient, which isn't who I am. Burnout doesn't just affect nurses, it also affects people who we care for. It was heartbreaking to know that we couldn't give our best even when the patient needed us most.
During the struggles of COVID-19, many hospital wards found themselves with not enough staff to carry the load of infected clients. With the lack of healthcare professionals, hospitals in Canada were desperate, reaching out to workers abroad to help with the crisis. But as COVID was a global issue, this attempt came back unsuccessful. Due to the lack of support, hospitals became high-risk environments that left nurses feeling vulnerable to infection and unable to prevent the spread of COVID-19.
How have nursing shortages affected nurses in the workplace during COVID-19?
Well, during COVID, it seemed as if hospitals all over Canada simply panicked instead of making a proper prevention plan to prevent the spread of the pathogen. Not only were there not enough nurses in general to compensate for the large number of clients that came in every day, but there were insufficient resources. Many hospitals faced a gross number of PPE shortages, and they received very little training. Nurses were kind of thrown in the water and told to swim or drown.
What was the result of lack of help in terms of both nurses and patients?
It was dangerous for both nurse and patient. Each person now had an equal chance of getting infected from the other. Nurses were overly exposed and without proper PPE, and patients were being treated with insufficient materials and personnel. There was a higher chance of you being infected with COVID within a hospital than from the public. But this is all historical since it has been seen before during the SARS outbreak.
If future infections like COVID-19 may arise again, what implications should be made now to improve hospital policies regarding outbreaks?
As the shortage not only affected Canada, but globally, not only medical, but also resource plans need to be made to compensate for the number of clients. Infection control needs to be a priority, so no hospital should ever face a PPE shortage. And every nurse globally should be heavily educated on mass outbreak infections. So should there be another outbreak, every hospital around the world handles the situation universally.